And there's perhaps no more stressful a situation than when you're confronted with a medical decision to make. And at some point, all of us are going to be in that position where we have to make a very important decision about the future of our medical care or that of a loved one to help them with the decision. And so I want to talk about that. And I'm going to talk about a very particular medical condition, but this stands as a proxy for all kinds of medical decision-making, and indeed for financial decision-making and social decision-making, any kind of decision you have to make that would benefit from a rational assessment of the facts. So, suppose you go to your doctor and the doctor says, I just got your lab work back, your cholesterol is a little high. Now, you all know that high cholesterol is associated with an increased risk of cardiovascular disease, heart attack, stroke. And so you're thinking having high cholesterol isn't the best thing. And so the doctor says, I'd like to give you a drug that'll help you lower your cholesterol, a statin. And you've probably heard of statins. You know that they're among the most widely prescribed drugs in the world today. You probably even know people who take them. And so you're thinking, yeah, give me the statin. But there's a question you should ask at this point, a statistic you should ask for that most doctors don't like talking about, and pharmaceutical companies like talking about even less. It's for the number needed to treat. Now, what is this, the NNT? It's the number of people that need to take a drug or undergo a surgery or any medical procedure before one person is helped. And you're thinking, what kind of crazy statistic is that? Why, the number should be 1. My doctor wouldn't prescribe something to me if it's not going to help. But actually, medical practice doesn't work that way. And it's not the doctor's fault. If anybody's fault, it's the fault of scientists like me. We haven't figured out the underlying mechanisms well enough. But GlaxoSmithKline estimates that 90% of the drugs work in only 30 to 50% of the people.